Hey guys, Josh here with Echo Health, and I am sitting here with Jackie Callihan, Doctor of Chiropractic Care and a Functional Nutritionist here in Coeur d'Alene, Idaho. And do you want to tell the people a little bit about kind of what you do?
Yeah, I'd love to.
Okay.
I'm Dr. Jackie. I'm a chiropractic kinesiologist at the Optimal Living Institute. I also practice functional nutrition as well. So one of the ways that I practice chiropractic is through a technique called applied kinesiology, which is muscle testing. So every vertebra and every organ in your body is related to a different muscle. And so one of the ways that we practice at my clinic is through that muscle test so that we can be as specific and as targeted as possible with our adjustments. We don't want to just go in and like whack and crack and send you out the door. We want it to be a full body, true healing, holistic experience with the most specific targeted adjustments that can be really truly like possible for each case.
Yeah. Whack and crack is a term that I've never heard, but I
Really?
like it.
Yes. Yep. Whack and crack is not the way we like to do it. It's a 30-minute appointment, really personalized. We don't want anyone to feel like they're just another number in our clinic.
Okay, that's awesome because there are so many whack and crack chiropractors out there, aka the walk-in clinics usually.
Yes,
right?
Yes.
So,
there's some even with that name. Many.
So like red flag for chiropractic care would be like a quick walk-in clinic. So maybe you can explain like you guys do like assessments and actually look at people and spend time with people and have reoccurring visits and things like that. So you really get to know a person, right?
Yeah. Yep. We really get to know a person. We really want to focus on wellness care as well. So I wouldn't necessarily say like it's a red flag to go into a really quick clinic because that is what some people want. That's all they need is they just want to go in, get their neck adjusted, and it's good. So there's different styles out there. The way that we practice is we want your body to, number one, hold the adjustment. I don't think that you need to be in the chiropractor 2 times a week for the rest of your life.
Totally.
I think that is kind of a way that the chiropractic overall practices kind of do the public a misservice, actually, because we don't truly need that. Your body is meant to handle the stressors. Chiropractic can help remove those stressors, but your body is meant to handle them and adapt to them. So we like to get people to a monthly adjustment as fast as we can. We want to get them to that ability where their body can handle the life stress. They can handle lifting heavy weights without having their back be thrown out, and they can actually do their daily duties without having any problems, which is really nice. And then we spend about an hour with every patient, especially on the front end when they're a new patient. And then follow-up visits are always 30 minutes or more if they need more.
That's amazing. Yeah. In the work that I have learned and do with the musculoskeletal system too, with like chronic rehabilitation, and I hear of people going to the chiropractor, either once a week or twice a week for a long period of time, and it's like
without the results
without the results. Yeah, exactly. And I'm like, maybe we should like visit a different modality, or a different provider, explore different options. So it's really awesome for me to hear that you like to empower your clients and or patients as get you to a maintenance plan. Is that what you call it? Maintenance plan?
Yeah, wellness care maintenance plan.
Okay, wellness care. Yeah, and then so who are some people you really like to see? So before we turned on the camera, we talked about women and babies. Seemed like a really good people for you.
Yes, yeah. I love working with pregnant women in general, and then I love babies, and I love them all the way through. So my nephews, when they were born, my youngest one in particular, I was able to adjust him right away. And then I went out of town, and he did not poop that entire time that I was out of town. And so when I got back in town, my sister was like, hey, he hasn't pooped. Can you come over and adjust him? So I went over for family dinner. I adjusted his hips, and that night he had a blowout. And she was like, oh, my gosh, amazing. Like, you never thought you'd be happy about a blowout. But here we are, like, super excited. So I always tell my patients that, especially with the babies, I always say, like, hey, you know what? They might have a blowout. I just had another patient tell me that after getting her baby adjusted, he pooped 3 times that same day, and they were all like great bowel movement. So it really does impact babies in particular to get adjusted. And then the pregnant moms too. Oh my goodness. It is so important. Your body releases a hormone called relaxin so that our birthing canal can open up so you can push out a human. Well, that also relaxes the rest of your body too, and it can cause sciatica pain. It can cause all these other things. And your hips start to tilt to make way for your belly. So your hips tilt backwards as your belly tips forwards. Actually, I guess your hips would tilt forward. So your hip curve really changes, and if your tailbone's not moving with it, then you'll have tailbone pain on top of it, and you have trouble sitting, and then now you've got a burning sensation down your leg. So there's a lot of different ways that chiropractic can help the pregnant body as it's moving through pregnancy, and then babies right after they're born all the way up. So I always tell moms, as soon as you're comfortable getting out of the house and you're comfortable bringing baby in, like, I don't have an hour restriction or an age restriction. It's whenever they're comfortable is when they can be seen.
That's really nice for new moms or even current moms who are pregnant, because life can be busy and hectic, and so having that flexibility is probably really nice.
Yes, it is super nice, and it helps them with sleeping, to help the baby sleep. It helps them with their digestion. It can help them with their latch to get adjusted as well, making sure that they, number one, can latch properly, and number two, are going to latch evenly to both breasts, because a lot of the times they won't want to turn their neck to one side or the other, so they'll only feed off of one breast. But if you think about it, being in a tiny little pregnant belly, that's really traumatic on a baby, and then they come out and we're always like, oh no, babies are fine. They had a lot of different stressors to their system that they might need some help with.
Yeah, totally. That's I remember you telling this story about you helped a client with her baby having trouble latching, right? And you adjusted the baby. And it was like almost instant. Is that right?
The mom said that after we adjusted baby, he was able to latch successfully every time she tried to feed, compared to just nighttime when he was tired. So daytime, when she was able to be home and feed, that really has helped him. And that's not a single story. Like, I hear that all the time with the latching. And then the other thing with babies is oftentimes they will get more spit up than really is necessary. So you'll feed them and then they just spit it right back up. My nephew was one of them, and you would pick him up even just like this, and he would everything right onto you. But it wasn't a violent throw up. It wasn't like he was gagging it up. It just came right out of his mouth. Wow. So that's really common, and that's typically occurs by something called a hiatal hernia, where your stomach kind of flips up over your diaphragm and then it gets stuck there. So then your stomach valve is sitting there open, so you lean forward, everything's going to come out because the valve is open. So with just a simple adjustment, sometimes babies cry, sometimes they giggle. My nephew is a giggler. You just pull that down, and it makes a huge, huge difference for them. And then they can keep in all the volume that they are getting when they're eating and actually gain the weight that they're supposed to be gaining.
Yeah, that's amazing, because the baby is going to feel a heck of a lot better. And whoever's holding the baby won't get puked on.
Yes, no burp cloths needed.
Or at least as much, right?
Yes, not as much.
So do you also see that in adults with, you mentioned like heartburn and like acid reflux. Do you give people adjustments and see differences in that way too? Yes,
definitely. So in adults, it typically manifests as heartburn or acid reflux, and it's because the stomach valve is sitting there open. So we'll take antacid, we'll pop Tums because we're like, oh, we have too much stomach acid. You actually typically don't have enough. So when that valve is sitting open and we pull it back down, I actually give my patients stomach acid to help them regrow how much they're supposed to have in their stomach. And they're like, oh no, that's going to give me more heartburn. 9 times out of 10, it doesn't, and it takes it away for them. It might take a couple adjustments, but getting... you have to set the thoracic back first, because that's what's connected to your diaphragm. So that T6 level, which is like the middle of your back, is connected. So if those two things don't go together, then you're not going to get all the benefits from it. But I see it in adults. In kids also, it can look like vomiting or really bad stomach aches. A term that's been used is abdominal migraines, which just means a migraine in your belly. And doing that adjustment has helped so many kiddos before, where they stop throwing up and they have no other term other than literally cyclic vomiting, which just means random vomiting. We adjust that and it takes it away. And then same thing with the abdominal migraines. We adjust that, do a little bit of laser, maybe some probiotic support, and it's gone.
That's amazing. Cause I'll tell you guys a quick story. When I was around 20 years old, I had acid reflux myself. I'm 32 now, and I don't really deal with that anymore, thankfully.
Yeah.
But what would happen is I would go to like 700 different doctors, right, and still come out with the same problem and medication to solve the not solve the problem, but in there I just solve the problem.
Yeah.
And it just didn't work, and I would hear the same thing. You have too much stomach acid. It's coming up, and and then you go to school and you learn things and you talk to people and you find the right people that you need in your life, and it's like you said, you don't have maybe too much, you don't have enough, so that mechanism isn't really communicating with the sphincter to close, right?
Right, and sometimes it can't close.
Right.
Yeah.
Yeah, and that's probably where adjustments come into play. So. Yeah, I had a friend one time. He called me and asked me about acid reflux, and I was like, "Well, are you stressed out? Or what are you eating?
Right?
Do you have food intolerances? How's your breathing going? Because you mentioned diaphragm, right?
Yep.
And diaphragmatic breathing, how is that? And I don't know. I don't think he was like implementing much, and so he kept on dealing with it. Like humans do.
Yep.
And so he was on the verge of getting a surgery, actually, to put one of those like magnet things or whatever.
Yeah, a lot of the times they'll put like a mesh netting to pull it down.
And that's not, well, one, it's not natural, right? So we don't want that in our body. And anything that's invasive into the body is going to cause scar tissues and probably further destruction and further problems down the road.
Yep.
So to bring this all around, having maybe an easy solution to let's just go in, get seen by Dr. Jackie, and get adjusted, and let's see if that fixes the problem. And if it doesn't, then well, maybe it's diet related, maybe it's stress related, maybe it's GI, maybe it's something else. And
then maybe there is an actual problem that needs a surgery or something, but that should, in my opinion, that should never be the first step. That should always be like, okay, I have exhausted my diet, I've exhausted doing the chiropractor, I've done all these other things, and still no relief.
Yeah.
It's time for surgery. It's time for those kinds of things.
Yes.
But it should never be that first plan of action.
Right. And in my opinion, PPI should also be in that category.
Yes.
Let's exhaust all these other things first.
Yes, before we go there.
Let's test, what is it? Pylori?
H. pylori?
Yes, H. pylori. Thank you.
Yeah.
Let's test H. pylori, see if you got that going on. And then someone like you who's a functional nutritionist can help those people even through that problem, right?
Right. Yep.
So how would you, for people who maybe suffer with acid reflux as a functional nutritionist, what would you tell those people?
So the first thing that I would do is I would test to see if they do have a hiatal hernia. And if they don't have that hiatal hernia, then I would add in HCl, which is your hydrochloric acid, right? Which is your stomach acid. I would add in some supplements for that. And then oftentimes we do a stool test called a GI map, and it actually cultures your stool long enough to see if H. pylori is going to show up. So a lot of the times the standard test for H. pylori is a stool test, and they just test it after, I want to say it's like a 1 to 3 day turnaround, and it'll say no. And then I've had patients go and do the breath test. It also says no, and I'm like, you have H. pylori. So then we send them to do the GI map stool test, and it comes back and they're just riddled with H. pylori. But you have to give it long enough for these things to actually culture themselves. So if I see that, then we have a different supplements that I might use. It also depends on if they're dealing with other things, like are you constipated, are you having diarrhea, is there bloating involved, and then it's a specific treatment protocol built off of all of those symptoms, off of your GI map, which also says, do you have any parasites, bacteria, fungus, molds, viruses, anything like that. It really tests all the pathogens, so there can be a true, complete profile of your gut microbiome.
Yeah, those GI maps are freaking amazing.
They're amazing. They're so cool. Yeah.
So if you come in for acid reflux and Jackie's going to do a GI map, you might find actually something else that's causing it that you didn't even expect in the first place, right?
Yep. And that's kind of how we like to do everything that we do at the Optimal Living Institute. So if you're coming in for nutrition or chiropractic services, even colon hydrotherapy or pediatric services, we really look at you as a whole being. It's not just, here's my one symptom, here's a Band-Aid to fix it. That's never how I want to treat people. I want them to feel like they are getting everything looked at and everything addressed, even if they didn't know they had it before. It was still a problem. It just hadn't presented yet. So we're really, really detailed. We do a lot of lab testing, all kinds of different things to make sure that we're seeing the whole picture, so that our patients are getting like true whole holistic healing.
Yeah, which is important, you know.
Yeah.
There's this concept of pain care, right? The pain care or sick model, however you want to call it, is like, if you are not looking at a person from a whole perspective, as all systems connected, you're kind of missing a lot. You miss
a huge chunk of them. You really do. It has to be preventative. It has to be, like, being in a reactive model is just, it's not it, in my opinion. Like, people never get better, because then you help them with one thing and then you never see them again, but they still had 12 other things that needed help with. You know what I mean? So we have patients who come in who are reactive, like a hep sciatica, or you throw your back out, or you're in a car accident. Obviously, I want them to come in too, but we take a lot of time to educate on why we do this, why we might use these supplements, why I believe in wellness care, why I adjust your full body, so that you understand what I'm doing and you also understand your body. I don't want you to like come out and not understand why you're taking whatever I sent you home with, or why you're coming in to get adjusted monthly.
Yeah.
I want you to understand it, because it's your body. It's true. Like, ultimately, it is your body, and you need to understand what's going on in your body to make the rest of your life the best decisions for the rest of your life.
A common thing I see too with people on that note is people will go through life never really knowing themselves, right? Never knowing their health, never knowing what foods throw them off, never getting an adjustment to get their nervous system back online, or flowing nicely at least. And it's just sad, because I think it stems from like growing up and someone never really being empowered enough to think for themselves, right? And so they're always relying on going to other people to tell them what to do, and they just never get in their body.
Yeah, and there's a generational thing with that as well. So older generations were told, like, no pain, no gain. You're going to work through it. You just show up, you go to work, you go home, you go to sleep. Like, there was no real, like, true understanding that that's not how it has to be. You should be able to feel good after you get home from work. You should have energy to go on a walk or to go do these things. You should also have high testosterone at 60 years old. Like, a lot of these things don't naturally decline like we're told they do. So when we're told, oh, nope, your back is going to hurt and you're going to be tired at 65. Not necessarily. Like, you should be able to go and do the activities that you want to. You might be slower or more cautious, but that's because you've learned, okay, if I do that motion and I'm not really bracing or preparing myself, then I'm going to hurt my back. But if we do everything in the right mechanics, the right safety, and you're taking care of yourself properly, you should be able to live the life you want to live for as long as you want to live it.
I always like to give homage to my teacher and mentor. His name's Paul Chek. This dude is, I think he's turning 63 this year.
Yeah, wow.
I just saw a video of this fool doing a freaking one-arm chin-up.
Yeah, I can't even do that.
I swear to God, he'll run freaking circles around most people, like even young athletes or even 30-year-olds like myself. I'm like, this guy. So that just goes to your point. It's like, when you're in your 60s, you should be able to still do
whatever you want to do.
Right?
Yeah,
do whatever you want to do.
Yep.
So I would love for you to kind of touch on the nervous system and how that plays a role with your chiropractic adjustments.
Yep. So your nervous system is the main control of our body, and everything stems from your brain, stems from your hypothalamus. And then from there, it sends it out to different parts, and it's like, okay, you're going to control the thyroid, you're going to control this, but everything has to start up top in our brain control center. So I like to think of the body like it's a highway. If you've got a bunch of different subluxations or you've got a bunch of scar tissue, you're going to have detours. And when your brain is trying to talk to your shoulder to go up above your head, but you've got all kinds of scar tissue in here, it's not going to get the signals. You're also not going to have that range of motion because of the scar tissue, because now you have a physical detour, but you also have a mental one because there's going to be a subluxation in that area. So when I go in and we adjust the different things, we muscle test where you're actually out, because I can feel your back and palpate and be like, oh, right there's out, but it might not be like muscle out. Your body is actually like doing just fine with it, and it doesn't necessarily need that to be moved. So that's where the muscle testing comes in handy, because it can prioritize what's actually like a necessity for that adjustment. But when that gets cleared, then your brain, those nerves can communicate so much faster, and they can just shoot right down to where they're supposed to go. And it makes such a difference for you, for your brain processing, for your body processing. I have kiddos that come in for when they're having bad moods, and they know, they'll be like, hey mom, hey dad, I need to go get adjusted because I'm snotty, or like they know it, and their parents know it too. And they'll come into me, and I ask them, I'll talk to them, I'll be like, oh, how are you doing today? And one little boy in particular, he'll always be like, you know, I've been having some bad moods. Like, I know I've been mean to my parents, or I've been doing bad in school. Like, I know I need to get adjusted. And they can feel it. And they're
That's
like,
amazing.
They're young kids. They know it because they're just learning their body. So if they're growing up and learning how to be in their body, it sets them up so much better for understanding their nervous system, understanding when they're having stressors, compared to being 30 and just starting it out. Like, you can do it, obviously, but it's going to take a little longer because you've been living in things chronically compared to being...
Some things are ingrained.
Yes,
right? It's hard to recalibrate those things. Those, what are they called? Not enneagrams. That's psychological things, right? What is it called? Enneagrams?
No, that's like your...
Engram.
Okay.
Engram.
I don't know.
Yes,
I don't know
okay.
what that is.
Well... Engram, yes. If you have, I believe, if I remember correctly, an engram is like a motor thing that's like when you do a bicep curl, right? You do it for a long time. That's like you've got an engram. It's like built in. It's almost like an autonomic response. Like you don't have to think about it. You know how to do a bicep curl. And so when those things are ingrained in you, it is hard, and it does
really
take
hard to stop it.
Capital W work to some intentions to reprogram that. And so adjusting the body to get those nerves flowing again in a quick and efficient way, like you said, it's going to help that so much. And by the way, kids who can identify that's amazing. That's amazing.
It's amazing, yeah. Oh, and they know too. Like, they know when they need to get adjusted.
I actually, I've never thought about chiropractic care for moods, but it totally makes sense.
Yep, it takes off so many stressors from our nervous system, and it allows your body to function at a height, like at the proper level, so that you don't have to be dealing with like, oh my gosh, my brain is like lighting up over here and this part is not lighting up. It gives your body the ability to work at its highest capacity.
Yeah, that's amazing. And then one other thing that you've talked about, I haven't heard many other chiropractors talk about, is adjusting tailbones.
Yes.
Tell me about that.
Okay, I'm a real weirdo, and tailbones are like my favorite thing in the entire world to adjust. So most chiropractors know how to adjust a tailbone externally, so that's like your normal above the clothes. They might have you lay on your side and adjust it. They might use a clicker. They might use the table and do a drop on it where you hear a loud noise.
Oh, sure, yeah.
And with that, if this is your tailbone, you can move the tailbone down. You can move it side to side, okay? That's all you can do.
Okay.
one of the adjustments that I love to do and I specialize in is an internal tailbone adjustment. And you go in rectally. It's 30 seconds. It's very, very fast.
Don't be scared.
Yeah, don't be scared. It's very, very fast, and it changes people's lives. So if you've fallen on your tailbone, if you've had a child and it's like they've kicked your tailbone or you've fractured it or you've done these things, your tailbone can actually, it's supposed to look like this. It can internally rotate. How are you going to get that from the outside? You literally can't.
Oh, yeah, 'cause
so
it's hooked under.
It's hooked underneath.
Yeah.
So I do an internal adjustment where I can come in, it's just one finger, and I do different motions, but I can do the unhooking of the tailbone. And so my boss, she has done for years external work to try to like unhook that tailbone. And then I came back from school. I knew how to do the internals, so I grabbed some of those patients and started working on them. And I had one lady say to me, when Dr. Sarah got done with me, it literally was like childbirth. I was sweating, she was sweating, we both were uncomfortable, and it was horrible. And then when you get done with me, the most uncomfortable thing is that I have to lower my pants in front of you. And she's like, that's the most uncomfortable thing. And it changed her life. After her first one, she went to Costco, maybe it's the second one. She went to Costco by herself, pushed her cart, unloaded the cart by herself, and took the groceries inside. She hadn't done that in years.
Really?
So
Wow.
she came in, she tells me this, and she goes, but don't tell my husband, though, because I still want him to come with me when I go to Costco and lift all the heavy stuff. But it makes such a big difference. It can get people their life back for sitting again. That transition from sitting to standing or standing to sitting can be painful. Bowel movements can be really painful for people who might have an internal rotation. But literally, if you have that tailbone that's rotated inwards, a lot of the times people just cannot function. It is so incredibly painful for them. And it's men and women both.
Oh, sure.
When I was in school, I probably did about 80% men was my clientele, and then 20% females as tailbones. And then here, my clinic is more female-based, so I would say it's maybe like 60-40 here. But when I was in Minnesota, 80% of my patients were male. And they, it's embarrassing to talk about at the beginning a lot of the times, but to me it's not, because it's so untalked about, and it really it really needs to be talked about. It needs to be, you need to be told that you don't have to live like this. You don't have to go get a cortisone shot. We don't need to do surgery. Like, there's so many options, and just doing that quick adjustment, it changes people's lives.
Yeah. So maybe how would somebody know if they need that? Like, you listed off a couple of symptoms.
A lot of the times you just know. Like,
you can just feel
they
it.
wouldn't be comfortable just seated in this position. Some people will have like donuts that they sit on, and there's a hole in the center that their tailbone will like kind of float in, so there's no pressure on it. If there's any sort of pain with the sitting, standing transitions, if you've ever fallen and broken it, even if it was in childhood, most of the time that thing is still rotated. And a lot of the times your body doesn't want to hear, I'm in pain all day long. Your brain doesn't want to hear that. So it'll turn off that circuit. It'll stop talking to it as often as it should be. So I'll work on somebody who might have fallen 25 years ago, and then afterwards they're like, oh man, now my tailbone hurts. What did you do? And I said, well, now your brain is talking to your tailbone. It hurt this whole time. Your brain just got tired of hearing I'm in pain, and now the sensation is turned back on. So then we have to do maybe a couple more or whatever. But those are really the big ones. Fractures, any sort of fall, any sort of, even if you're just like, man, when I have a bowel movement, like that's painful on my tailbone, and your tailbone is like right in that crack, like you can just right in your crack, you know where it's at. So those are kind of the biggest things that I hear people come in with, or pregnancy related.
Oh, okay. Yeah, interesting. Yeah, that tailbone stuff, man, that can be very uncomfortable for people, but it sounds like you make it like a nice experience, you know, and to know the outcome of what your life could be like after you get that adjusted. I say, if you're feeling anything like what Jackie explained, you gotta go check her out. Let her check you out.
And then I also use a red light laser after I do the adjustment, and I program it to specific wavelengths for inflammation. So I do the adjustment. It creates inflammation because it's like a painful area. And then I put the laser on over top, and then you just lay on the table like you don't feel anything. But I put the laser on over top, and that has significantly improved the speed that my patients have healed into like the extent that they're healing. They're getting faster. They're getting better results faster than I was receiving in Minnesota because I did not have that technology there.
Oh, wow. Yeah.
So, and it's really, really awesome.
Red light. Do you know much about red light? Like maybe the why behind that? Like what is it about red light that is speeding up the process?
Yes. So the red light we use is the Erconia brand. It's an FDA certified cold laser, I guess would be the term for it. There's another classification I can't think of. And the one we have, we can program it to specific wavelengths for whatever your body is dealing with. So every cell in our body responds to specific wavelengths.
Okay.
So inflammation has wavelengths that'll help to reduce it. Allergies has specific wavelengths. Pink eye, they all have specific wavelengths that I can type in so that your body can stimulate, or the lasers will stimulate your mitochondria to do whatever I'm telling it to do. So if I say clean up the inflammation, the mitochondria are going to go to work. If I say there's infection that we're working on, I've used it on, I have a diabetic patient who has wounds, and I've been using it on his wounds, and he's also been getting ozone therapy done at another clinic, and his wounds are so much better than they ever were. Like he had a hole in his foot this big, in the bottom of his foot, and now we're like this. Dang. And he is no longer oozing out of it. There's no longer pus in it. He's not constantly on like antibiotics in that area anymore. And it's like, it truly, cold red light laser is one of the most amazing technologies that I have ever gotten to witness.
Yeah, okay. So
it is amazing.
So go try it.
Yeah.
If you think you need it.
Yeah, everyone needs it.
Everyone needs it. So
I do it on my brain all the time. I just lay under there for 20 minutes, take a little nap, and I can feel my brain just like taking a breath.
Oh,
just
there you go.
And I feel so much better when I get up.
Yeah, that's amazing. Is there anything else that you would want to tell people maybe about chiropractic care, functional, or even Optimal Living Institute, or how can people find you? All that good stuff.
Yeah. The biggest thing I want to say is not all chiropractors are the same. There's good ones and there's bad ones, and depending upon what your needs are and what you want, we might be the right fit. We also might not be the right fit, right? Nice. There's so many different techniques out there. There's so many different kinds of clinics. So at the Optimal Living Institute, like I said, we really focus on holistic, whole body healing. We never want to take just a Band-Aid approach. We want to get to the root cause of your symptoms in everything that we do. We really like to work with people who are motivated, and people, oftentimes we have people who tell us, you know what, you're my last hope. Like, you're the last person that I could think of. I've been everywhere. Nobody has helped me. And those are the patients who always do amazing. All of our patients do, but those are the ones who really want to work hard because they've exhausted all their options and have finally found a place that wants to help them and will follow them long enough. So even with we have a pediatric nurse practitioner, Dr. Alicia, who does an amazing job, and she follows kids from 0 to 21. She even does wellness labs on little kids to see how is their iron, are they metabolizing things correctly, are they detoxing correctly. In our colon hydrotherapist, she's been trained in supplements, she's been trained in some of the GI maps and testing, same with our pediatrician. So we really want you and your whole family to be healthy. It's not just, mom goes here, nobody else does. We want the whole family involved, because that's where you become a healed family, and then you produce healthy offspring, and you produce a healthy community.
Yeah, and healthy communities and healthy people is always a good thing.
Yeah, exactly. Exactly.
Yeah. So, how can people maybe book an appointment with you, or do they need to do an assessment with you first? Like, how to maybe just give them the lowdown.
Yeah, for sure. So I do offer free 15-minute consultations, mostly for our functional nutrition, but I can also do that for chiropractic as well. Our clinic's website is optimallivinginstituteidaho.com, and that has all of the information about all of our services, all of our providers, kind of how we work. And our clinic phone number is 208-930-4177, and that is like the best way to figure out who's the provider for you, answer any questions. Our front desk staff, Amy, is amazing, and she's really good at filtering you to the right provider for whatever's going on with your needs.
Awesome. Yes.
Yeah.
Thanks so much for coming on. If you guys have not seen the last, I'll call it an episode, but it's pretty unofficial. We had Shane McVeigh on talking about water filters, all the things he finds in it. Seriously, such a good conversation. It's on our Facebook page and YouTube. Go check that out. And I'm excited to also be bringing on someone else at the Optimal Living Institute. Well, I don't know. We're not booked yet, but I'm hoping Kylie comes on. She's the colon hydrotherapist.
Yes.
That'll be a super exciting conversation.
More water.
Yeah, more water.
In a different area. You're not drinking that water, though.
It's coming in a different hole, yeah. So keep a lookout for that. And then we also got a medical massage guy coming on, Brandon Cope. So stay tuned. Follow the page. Find Jackie, book with her, and do all the things, man. So thanks again.
Thank you for having me.
Totally.